It is the second leading cause of cancer-related deaths nationally, but it is survivable if detected early. March is Colon Cancer Awareness Month, and there's a push for people to get screened at a younger age. Joining us this morning with more about the disease is Dr. Stuart Bloom from Minnesota Oncology, and Dr. Bloom is also a colon cancer survivor. Thank you for joining us, and congratulations for that. First of all, tell us,
Thank you.
When were you diagnosed? How did this come about?
Well, so it kind of blends right into screening. So I had a grandfather who died of colon cancer at the age of 60, and we assumed that colon cancer grows slowly, so he probably had it at 59. And the rule of thumb for cancer screening is you should be screened 10 years younger than that first cancer. So I was 49, and one of the colon surgeons with whom I was working said, "Why don't we screen you?" And insert your own joke here. But anyway, I did get screened, and boom, they found a colon cancer in me.
Wow.
At 49. It was life-altering. You go to some dark places, when you first hear about it. And, the added, irony of me being, an oncologist.
Exactly.
But the truth is that I guess I'm an advertisement for screening because I was cured. It was found very early.
Good.
It was a stage 1 cancer, cured with surgery alone. In fact, many of my patients have had to go through a lot more than I ended up going through. So
being a doctor yourself, you know about the prevention. This is just speaks to that it can happen to people in good health who even know the signs and are looking for it.
Exactly. So, so that the signs are, in shows like this, we're always talking about the signs, but the truth is we screen people to try to prevent the signs from happening. We don't even want to have any symptoms at all. A good screening test finds a cancer early when it's still curable.
Okay.
And as you had mentioned, colon cancer is the second leading cause of cancer worldwide. But the good news is that there are less people being diagnosed with it, and there's less people dying from it, and that's really due, for the most part, to screening.
That is very good news. Now, people are recommended to get screened at 50. You got screened earlier because of your family history.
Right.
But there are some statistics out there that show that people are getting diagnosed at younger ages. So would you recommend people get?
No.
Colonoscopies earlier?
So there are people, the recommendations, the United States Preventative Services Task Force, our big guidelines group, is coming up with a new, an update to their recommendations. And it's still, you should be started to get screened at 50 for the person with average risk, for, no family history, no history of ulcerative colitis, no inherited predispositions to colon cancer. So it really should start at 50. I had, if you have a first-degree family relative, and that just means your father or your siblings or your child, you should be screened earlier. It turns out my grandfather being diagnosed with colon cancer was not one of the things that they would say that you should get screened earlier.
Oh, interesting.
So had I waited till I was 50, you'd probably be talking to somebody else right now.
Wow, oh my goodness. Don't even want to think about that. Now, you have a list of questions, too, that if people answer yes to some of these questions, and they have a higher risk. And we have several of those questions I think we can show up on the screen. Family history, obviously, we talked about that.
Right.
But diabetes, do you smoke? There's a whole list of things.
So according to those, basically, there are certain things that give you a higher risk than others. And do you remember maybe a month or two ago there was this thing that if you eat bacon, you increase your risk of colon cancer by 20%. And smoking increases the risk of cancer. But the truth is, the absolute increase in risk is still really low. So the bacon thing, that increased your risk of colon cancer by 20%. So if 1 out of 20, and that's the risk that we have in the U.S., lifetime of getting colon cancer, if you double your risk, that's 2 out of 20. That would be a 100% increase. But the bacon thing was just 20%. So you go from 1 out of 20 to 1.2 out of 20. So it's not huge. So I don't want people who love bacon to, be writing your show.
And a lot of us love bacon, too. And, of course, we don't want to forget that men do have a higher risk, of course. So
they do.
Be aware of that and get to the doctor and, don't neglect it. So thank you, doctor. We appreciate your time so much and your insight.
Thanks for having me.
Good reminder for people to get screened. So we appreciate it. I'm glad you're here. Glad you survived it. 8 years behind him, long in the past. All right. Thank you.